Hello everyone, welcome to Introduction to Cytology. By the end of this video, should be able to answer the following questions. One, should be able to define the following terminologies. One, what pathology is. Number two, what is cytology? Number three, what is histopathology? Number four, what histology is. So to begin with, pathology. Pathology is derived from two words. Pathology is derived from two words. One is pathos, which means suffering. The second one is logos, which means study. So by that, pathology refers to the scientific study of structure and function in disease. That is what we call pathology. Then the other terminology is cytology, or you can call it cytopathology, which is a branch of pathology that studies diseases at cellular level. That is cytology. Then the next one is histopathology. So histopathology refers to the study of tissues affected by disease. That is histopathology. Then the other terminology is histology. And histology refers to the study of tissues and their structure. So those are the few terminologies in our introduction, but basically we are looking at cytology, but you cannot look at cytology without defining some of those terminology. Number two, we must be able to appreciate the role of cytology in medicine. So, what are the roles of cytology in medicine? We should be able to appreciate what are the roles of cytology in medicine. So one of the key roles of cytology in medicine, it provides preliminary diagnosis of cancer. So when we talk about preliminary diagnosis of cancer, this cancer must be confirmed later by histopathological techniques. For example, detection of ovarian cancer cells in ascitic fluid. So when we detect ovarian cancer cells in ascitic fluid, This indicates that there is probably cancer of the ovaries. So for us to confirm that really the cancer comes from the ovaries, we must go and pick a biopsy from the ovaries. So this biopsy is processed histologically and later will give us the final results. So histology is giving us a preliminary diagnosis of cancer that will later be confirmed histologically. Number two, cytology is very important in detection of clinically silent early cancer. For example, carcinoma in situ of the uterine cervix. Number three, cytology is very important in assessing response to therapy. So how does it help in assessing response to therapy? An example is use of cervical smears for response to radiotherapy in carcinoma of the cervix. So in this case, if a patient is diagnosed with cancer of the cervix and is initiated on radiotherapy, we can monitor response to therapy by using cervical smears. So a cervical smear is picked and examined to check whether there is a change or response in radiotherapy. The second example can be use of urinary cytology for response to chemotherapy in cases of carcinoma of the urinary bladder. So in this case, still a sample will be taken cytologically. That's why we are talking about urinary cytology. Then examine to check whether the patient is responding to chemotherapy in case of carcinoma of the urinary bladder. Number four, cytology is very important in diagnosis of non-neoplastic or inflammatory conditions. One of the examples is in cases of Hashimoto's thyroiditis. Hashimoto thyroiditis is evidenced by increased number of lymphocytes. So non-neoplastic or inflammatory conditions. Non-neoplastic is a non-cancerous condition, but cytology can help us to detect such conditions. For example, in Hashimoto's thyroiditis, we are going to see an increased number of lymphocytes. Then number five, still cytology is very important in diagnosis of specific infections. And these infections can be caused by various agents, which range from bacterial, viral, protozoal, and probably fungi. So cytologically, we are able to detect specific infections that can be caused by bacteria, can be caused by viruses, protozoa, and fungi. For example, detection of tubercle bacilli in lymph node aspirates. So we can pick the sample cytologically from the lymph node and examine and find tubercle bacilli, which is a bacteria in nature. Still, we can find We can find Trichomonas vaginalis in cases of cervicovaginal smears. We can still find fungal hyphae in touch preparations from draining sinuses. Number 6, cytology is very important in identification of chromosomal abnormalities under cytogenetics. So, cytology can detect or can help us to detect various chromosomal abnormalities by using the various methods. Number 7, cytology is very important in assessing hormonal status in women. So by use of vaginal smears, these smears are stained and examined. So on examination, we are able to detect, for example, whether a woman is soon starting menopause, or it's very important in confirming the onset of menopause. That is hormonal status in women. Number 8, it's very important for research purposes. So a lot of research is being done to ascertain the risk factors related to various cancers, how best they can be diagnosed, and the behavior of various cancers. Number 9, it is very important in identification of cause of death. This is very common with postmortem cases, whereby a touch preparation can be, for example, carried out on the brain to ascertain the cause of death. Number 10, very important in screening for malignancies. So, for example, cervical cancer, we can use various techniques like use of Lugol's iodine and acetic acid to check or screen for malignancies or the cancer, and a classical example is use the cancer of the cervix. Thank you very much for listening.